Welcome to the latest episode of the Face podcast. I'm here with multi-award winning, board certified plastic surgeon, Dr. Garth Fisher, whose celebrity A-list clientele would make you quiver. Thank you very much for joining us here today, Garth.
Thank you for including me. I appreciate this.
We have many things to touch on today. I wanted to really go back to, where it all started. I had read parts of your story where you grew up in Mississippi and you originally wanted to study architecture. How did you end up becoming a plastic surgeon?
Well, I was good in math and science, those kind of things. My father was, shot down in the Vietnam War when I was 9 or 10 years old, so I never had a father after that. And I was actually financially trying to take care of my family. We were quite poor, and I was dating the head surgeon's daughter in this hospital where I was a janitor at, and I think the surgeon was probably very embarrassed his daughter was dating a janitor. So he thought I had some promise and potential. So he came out in the hall one day. I literally put my mop down. He said, "Please come watch me do this surgery." And I went in. I said, "I'm going to be a surgeon." So I went the next day and redirected my major in college. It was at a small junior college in the middle of nowhere in Mississippi. And at that point, I was going to be an architect because I was good in science and math and spatial relationships. And it was interesting to me, so I thought I would be that. But I just never was exposed to medicine and surgery until that day. And then for sure, I said, I'm going to be a surgeon. And then it kind of branched out, as I went through my training, medical school, surgery, and I had different options available to me. I love trauma surgery, but it's always 3 a.m. And plastic surgery, I love the patients, and I, love doing that type of thing. I had a good eye for beauty. And so it just kind of gradually evolved, and I would end up being in the plastic surgery field. So I'm very happy to be here.
So you ended up here in Los Angeles, and I also read a very interesting point in your career that the late Hugh Hefner actually saw some of your work, meaning a breast augmentation, on one of your patients. So how did that come about?
That was actually I've been very fortunate and blessed in a lot of different ways. That was like an Oprah moment for me. I trained with Bruce Cannell, who is, I think is the greatest facelift surgeon ever. And I spent time with him, and I just wanted to do facelifts, which I was doing a lot of in the very beginning of my career, and breast surgery was just so easy for me. But then Hefner actually recognized some of my work, called the office, and I was speaking with him, and he said, "These are great. Did you do them?" I said, "Yeah." And he said, "We're going to send all the girls from the mansion to you." And from that point on, it was like an avalanche hit this office. And, like you're at the bottom of a ski slope selling bracelets. Now you're selling earrings or the reverse, whatever it is. So then I became like the breast guy, the breast god, the boob god. And, that was, I'm glad to have that, as a name, but what about the facelifts I've been doing all these times? And so, whatever. I've been very happy, and I've met a lot of people, had a lot of great, things happen for me, my staff, my family, and I'm very, very happy with how it turned out. But that was an Oprah call. It was like, I was just, it was a grace and being blessed to have that happen for me.
So that's happened, and then you were part of the first reality television series, which was internationally famous. That is how I learned about you, which was called Extreme Makeover.
Right.
Now, that must have been a very big part of your career.
It was. I look back at that, and I'm so thankful. I mean, I was lucky. Howard Schultz came to my office, and he started talking about this show that never been a reality show on plastic surgery. And he said, I'm going to do this show, Cinderella for a day, all these people that never have access to this. We're going to bring them in, hair, makeup, teeth, LASIK surgery, plastic surgery, and just try to make them have the most special life and give them a gift of life. And, at that point when he walked in my office, my waiting list was 1 year.
Wow.
And I thought, this is going to screw up my practice. I don't want to do it. It was so far-fetched. I said, "Howard, I'm not the guy." And I turned him down. And he went and interviewed a lot of other plastic surgeons in the country. He came back a month later, and he said, "Garth, I want you to be this surgeon." And we had another heart-to-heart talk, and I felt like it wasn't going to really exploit patients. It was going to be good for my profession. I thought that I would have control. I had a very good rapport with him, and I thought that I'd be able to control all this so it would not be, wild, crazy stuff on TV. And, we saw eye to eye, and we both developed that show. I developed the medical side of it, and engaged all the doctors. And the first night, it was a hit. It was fantastic. Of course, you know, they say buffalo in middle of herd catch no arrow, and I was the first one out of the gate. So I got a lot of jealous people after me, and they didn't know why I'm doing the show and not them. And while they were trying to, you know, get me kicked out of all these different, you know, entities, they were behind the scenes telling ABC, I want to be in there.
So entities in terms of cosmetic plastic surgery associations and committees and
people that were head of the plastic surgery societies. You know, they were filing complaints about me because it was unethical for me to be involved in this show. It was so new, you know. But the same people, because I was kind of a darling of ABC, because I was the person in the show, the same people were trying to go around the back door saying, put me on the show, put me on the show. We want to advertise on the show. So that left kind of a bad taste in my mouth. It's like, okay, fine. But I understand it. But, you know, I think in anything, jealousy is one of the most, you know, destructive emotions anybody can have. It is. But past that, you know, the show is a success. I think it brought plastic surgery out of the woodwork. It increased the plastic surgery IQ of a lot of people. And it, you know, it just brought it to the forefront where it was really in the darkness. And I think now, after that, it was such a huge monumental thing to like expose people to these opportunities. And
the results were absolutely fascinating because, you know, the teeth were addressed, you know, you had a personal trainer, their diet. So how long were the patients actually away from their families during this process? It
was like 6 weeks. Yeah. And again, all those different disciplines, you know, this had a ripple effect through the entire beauty industry. Absolutely. Makeup, hair, toothpaste. I mean, you name it, veneers, all this stuff. And you know, the other part of this, which was high pressure for me, was I had 6 weeks for these patients to look good on TV.
Yeah.
I mean,
6 weeks. I was thinking you were going to say 6 months.
No, this is 6 weeks. I remember the first time I did something on TV, actually it was before then, it was Lisa Gibbons' show. And they said, we're going to do a rhinoplasty. And it was a difficult case, actually. And we're going to take off the splint 1 week after surgery on national TV. And I'm like,
oh no.
Well, I hope this is going to look good because they're swollen, you know. And I remember pulling off, I pulled it off a little bit. Looks good. Pull it off a little bit more. Still looks good. Pull it off the end. You know, I was just hoping and it looked good. But it's a lot of stress and pressure for doctors. You know, we all, you know, we can't bet 100%, on everything. And, you know, I'm one of those guys too. You know, I'm as perfect as much as I can be and I try to be, but it's a lot of stress. So.
I did love the show because the patients that were chosen were fairly, you know, average looking, not to be disrespectful, but they really were enhanced in such a beautiful way. And that moment where they're revealed to their family, it was, you know, a goosebump moment. It was so special. Everyone was crying. Everyone was excited. There was so much positivity around these patients that maybe, you know, were bullied at high school or, you know, they didn't have the easiest transition growing up. I really liked that about the show.
Well, you're exactly right. And that was the goal. And that's what I knew was the goal from Howard's heart and brain to what he was talking about. And, you know, I can't speak for every plastic surgeon, but I would assume, because I know for me, the greatest thing that we do, I mean, we enjoy the making, the painting, the sculpture, doing the surgery. We love that. But what really, really drives us is the gratification you get from walking in a room and you see a smiling patient that says, wow, you changed my life. I'm so confident and happy. And, you know, without that, there's no payoff here. That's what you're trying to get every time. And, you know, that's what we love.
Talk about that, though, you know, building a successful practice. Like, what has been your philosophy in driving that?
There's so much into building a practice. I think one is you have to be skilled. You have to be talented. So no matter what conversation you have with a patient, you've got to be able to deliver what the goal is. Or you got to tell them the truth right there so you don't have an unhappy patient that's expectations are not managed. You have somebody that's just not happy with the result, because that's a disaster. So it's being honest, being able to technically know when you can do something. I'm not going to do something I can't do. Go to somebody else.
Sure.
Find a better doctor. So it's that, I think, is probably the most important thing. You know, educating them on everything. That's key. So I think those are the things that are most important. Is the being able to do it, the honesty, educating them, having good communication skills with these people so they know what's going to happen, what's not going to happen. And you're a part of the process with these people. You're a teammate. You're a teammate. And you tell them what you can do, what you can't do. I think that's the most important. You know, obviously you want to keep your nose clean, make sure that you don't do anything, you know, that makes you, you know, you got to have, morals and ethical, values.
We really saw a massive upturn in patient volume, especially in non-surgical practice post-COVID, because so many people were looking at themselves on Zoom. They probably never looked at themselves so often in that terrible lighting and those reverse cameras. Did you find that in your practice?
Well, you know what? The thing about, I think, being in Beverly Hills is, as opposed to maybe, not to pick on Kansas, but
sure,
in Beverly Hills, you got these people running back, looking at this high definition, cameras, videos, and playback and film and film and film, and they're looking at every pore, and it's a little bit harder to control that. And everybody, I guess, wants to be perfect or more perfect, and so that was a little bit. It's a little bit difficult in that regard here. But then Instagram came, and you see all these filters, and it's just not realistic.
No.
And you can't capitalize that and say, I'm going to make you look like this filter. It's just not going to happen. And you're going to have an unhappy patient, and you're going to have an unhappy life because your patient's unhappy. So you just can't fall to that. And I think it's like, no, you're not going to get that. You're not going to receive that. And we use Michael Jackson as kind of an example, because for a long time, people would come in and say, I don't want a nose job because I don't want to look like Michael Jackson. Well, a lot of people don't look like him that had great nose jobs.
Sure.
So it's not, don't feel that that's going to happen to you. Why do you keep having surgery? That is the surgeon's fault. I don't blame Michael Jackson for wanting to fix his nose.
No.
I would want to fix it too. I'd go to the next person. The problem is the next person should say, no, it's going to get worse. No, stop. And that's the problem. And so it's our responsibility, I think, to dictate what's necessary, what's appropriate, and what the possibilities are, and be honest with our patients.
We are in the epicenter of Hollywood, and you have a huge A-list celebrity client base. Are patients being operated on at a much younger age?
Yeah, younger ages are a little bit more tedious. I have daughters, and I think that there's an age when you can do something, when you can't. I mean, I will operate on a 14-year-old girl if she's got something that's so bad she's going to get scarred for the next 5 years.
Sure.
But I make that judgment decision. I don't, operate on people that want to be a movie star at age 16 and they see something that's, aspirational in a picture, inspirational, whatever. But for people doing facelifts at age 29 and 30, I mean, you can take a 4-year-old kid and there's movement there. That doesn't mean you need a facelift. And I think that's pretty grotesque, actually.
I'm sitting here with you in Beverly Hills, and, you have an A-list celebrity clientele. What are they asking for in 2024?
There's several sets of patients. Some that I want a natural result. I don't want people to notice. And then some that want a stylized, I want to look like this. I want to look there's different ideas of what patients want. And if I don't mirror that, and I don't think that I can or want to deliver what they want, I just remove myself from the picture. But for me, in 30 years, I think things are very similar. They're more aware. People are more, they understand plastic surgery and what their options are more now, but they want a natural result, the ones that are coming here. They want a conservative. I like understated. I don't want people to look like they've had plastic surgery. And look, I've had my days even with breasts, putting the huge implants in. I don't really do that anymore.
Sure.
But I've been through that too. But even with faces, I mean, I just like a natural result. But there's some doctors and colleagues, not saying that they're wrong or bad. Their aesthetic is to, these blown up faces that, to me, I don't like that. And there's girls that ask for that too. And, good for them. I'm just not that, I'm not that person. So
celebrities are still extremely shy about, revealing what they've had done. So there still is a stigma around being open. We do often see stories where celebrities admit that they've had this, that, and the other. And I think the consumer or the public love following those stories. But why are celebrities still a little bit scared to reveal all?
Well, you're right. And everybody's not the same. Some people go out and say that I had this.
Yeah.
But most people, I didn't have plastic surgery. I'm natural. It's because of the way they think it's going to be perceived. I look at my great dentist friends, and everybody's saying, I got my veneers done here. I got my veneers done there. I say, well, why don't you tell them where you had your face or you this or that? They won't go that far. So it's a little different. They'll talk about their dermabrasion or their injectables, maybe Botox, go here, but they won't talk about plastic surgery. It's gotten a lot better. Even for men, it's gotten a lot better. And, it's up to the patient. If they don't want to tell somebody, it's their prerogative. It's their business. I mean, it's not, we really haven't had a leak in our office. We've been very good about that. And, I just think confidentiality is very important. And you want to preserve that doctor-patient relationship. But, everybody's different in that regard.
You love doing facelifts?
I love facelifts. Whatever I do, I love doing it. If I don't love doing it, I'm not going to do it anymore. But I love operating. If I was given, $2 billion tomorrow, I'd still come back to the operating room. I like the relationship with my patients. I like doing the surgery. I like the high of seeing them happy. And it's like, wow, look what we did. That makes me feel useful. Makes me feel good. It makes me feel purposeful. It makes me give a meaning to what I've done in my life. Other than a lot of different things I could do that are less meaningful.
Are men in Hollywood having facelifts more regularly?
Yes.
Yes. What would be a good age? Because men have thicker skin, okay? Right. So to avoid that very obvious look that some celebrities have had over the years with their faces, what would be a good age for a man to have a facelift? So
I don't really say there's an age. I mean, if you look at people as they age, there may be 1% of the population at age 31 or 30 years old that just fell apart. They've been in the sun in South Florida every day on a yacht or a boat, And some people age 70, they look damn good, and you wonder what they had done, and nothing was done. So, it's not like what age should you start. It's like taking each person as an individual and seeing what their goals are and what you can improve, where it's worth the risk and the benefit, the risk versus the benefit of doing something. So I don't really have an age. Now, if you look at the group of people, when you get in your 45 to 48, most people fall under that umbrella, like, you'll benefit from this. But I never tell somebody they need something. I just tell them you'll benefit or you won't. And then I step back from a personal standpoint and I say, would I recommend this for a family member? And I never would tell somebody, you need to do this because I need to pay my mortgage or something like. I'm not going to do that. I just try to be honest with them. And I think that if you take care of your patient, they'll take care of you. And the most important currency of any relationship, whether it's business, personal, whatever, most important currency is trust. And you have to have that relationship with your patients.
So true. I have read that one of your philosophies for your practice is along those lines, like treating your patient like family. Can you talk a little bit about that?
Well, I do treat my patients like family members, and I give them advice as if they were a family member. I feel like I'm very honest with my patients, and I will tell them not to do this. I mean, we turn away probably 30-40% of people that come in here anyway, and it's for different reasons. One is I don't think they're going to get the result that they want. Number two, they're like expecting something very, very different. Number three, maybe there's not energy between us that I want in my plastic surgery family, and same may be for them. And then you always hear these little red flags that come up. My last doctor screwed me over. My last, all these things. And, and then there's some people that, I always use the blackjack scale. A lot of people never play 21 or blackjack where you're trying to get a 21, a king and an ace or something like that. And I tell them, look, if you got a 10, take another card, have surgery. If you got a 14, take another card. If you're 16, you got to start getting more careful. But when you're 18, 19, and 20 and you start trying to get that 2 or 3, most likely you're going to bust. And I say, you got to hold. You may not like it, but that's probably the best place to be. And it's always best to try the least invasive, least expensive, least risky thing first to try to get you closer to your dreams. And I think that's good judgment for them too.
I feel like, since COVID, there's been such an increase in treatments, both surgical and non-surgical. Getting back to that point about realistic expectations, we've had to manage that, in the non-surgical arena.
Correct.
Looking towards, celebrity culture and expecting a surgical result from a non-surgical treatment. How do you find that?
Well, you just tell them this is not surgery, and this is what you can accomplish, and this is what you can't. And you have to do that without the fear of them saying, well, I don't want to go here. I'm going to go somewhere, and they're going to tell me that I can give them one neuromodulator and one injection, and I'm going to look like, whatever they want to look like. And I think that there's too many people that are saying yes and talking them into that. And it's a ball that gets worse and worse rolling down the hill. So Yeah, I mean, we control that. We control that narrative, really, and we can and we should. And I think in the end, you'll get more patients from being honest with them than you will from doing something that's not going to reach your expectations. And look, they don't understand that celebrities have these pictures that they're looking at.
They're not real.
These have been,
Absolutely.
because I know you get a picture and before it gets pushed out into the environment or into the media, it's probably been, changed,
100%.
modified, filters, all this other stuff. And you see these people that if you see in real life, they don't look like that.
No.
And then plus, some of these people have more money to do this constantly and stay on top of it. Good for them. Look, that's good for them. And some of them are absolutely stunning and gorgeous. But
Sure.
I think that you just can't expect that from a just a normal everyday physician.
And the apps you can get, to doctor a photo just on a normal iPhone are amazing. I mean, imagine having the technology to really airbrush and having that, high level skill. I mean, you're not looking at a picture that's real.
Exactly. And when you look at a movie, you're looking at a movie where this person is glamorized in the most seductive lighting.
Yes.
With the background music, with the filters, having shot this probably 25 times to get it just perfect. And then it goes to the editing bay.
Sure.
And you're looking like, I want to look like that. Where did they go? It doesn't matter where they went. This is not, you have to reverse and go back a few steps. And, everybody wants to look better. Not everybody, but a lot of people want to look better. They'll iron their shirt. They'll brush their hair. They'll brush their teeth. Some people will go have plastic surgery. These are the people we're working on. And I think patients and doctors just have to be careful.
The social media, uprise has been so wonderful in so many ways, but it's also been a minefield for patients choosing the right provider. What advice would you have if a patient was looking for a breast augmentation or wanting, a tummy tuck post having children? What would be the best avenue?
I think finding a friend that was really happy and liked how she was cared for, he or she was cared for, go interview that doctor and interview several doctors. I got to say that, number one, it's great to be board certified because that means you went to all the courses and you passed your tests.
Sure.
It doesn't really measure your ability to operate or your artistic sensitivity or your ability to make something look good. The problem in plastic surgery is it's not like plumbing or vascular surgery, not saying those are the same, but you just connect two things. We have to connect two things and make it look beautiful. So there's an artistic component to that. And you can give 10 paintbrushes and the best canvas, the best paint, to 10 different plastic surgeons. 2 will make masterpieces. 6 will make looks pretty good. And 2 will make absolute cartoons. Now, that's because not everybody's artistically inclined. And that's the missing thing in plastic surgery. Heart surgery, connect the coronary vessels, be a fantastic doctor, close it up. You don't see what the heart looks like or what, but we have a lot different of an issue. And so when you're trying to come to that decision of who to choose, not all doctors are the same. And I'm not putting myself any higher than anybody else.
Sure.
I'm not saying that, but I'm just saying that you've got to consider a lot of different things. And, I think there's a problem. Just because you're board certified doesn't mean you're going to be a good doctor. There's some really smart doctors. You wouldn't want operating on your dog. There's some really, unsmart doctors are probably really great with their hands. And so it's just hard to kind of, it's a minefield for patients to try to figure out who am I going to go to? And then you got this whole marketing thing. Marketing just infuses all this, amplifies everything. And you think, well, this is where I'm going to go. So I don't know. It's tough for a patient. And I think just going to another patient and finding out where they went and get several opinions and see who you feel comfortable with.
I find that there's been, an overuse of fillers internationally. I had a patient recently come to my practice for a consultation and was seeking fillers, and there was just not, a millimeter of space in this lady's face for anything further. She was absolutely overfilled, obviously could not see what I was seeing, and left, quite upset because I refused to treat her. Do you think that these products have been overused?
Well, you've done the right thing, and that's the way you should be, because you don't want to be attached to that person. And, I always think about that these patients really need close, good friends that will tell them to stop doing this. And I realized what happened because I saw a patient like this one time, and I couldn't even really concentrate on anything because there was so much filler. And by the end of the night, I became used to it. And I said, aha, that's what happens.
Wow.
They get used to it. They've seen it for so long, this is their norm. And their friends aren't telling them, hey, Betty, you need to stop. So that's the problem, is people kind of get used to that. And it's just, I guess some doctors or nurses feel like this looks good, so they do it. But I don't think that's you. It's certainly not me.
No.
And, I think we should still try to direct our patients to what's right and what looks good. And everybody's aesthetic. Everybody's got a right to their own aesthetic. And maybe some people really like and want that. But I can't stand these overblown lips and cheeks. And somebody look like they've been hit with they look like they've had like 20 wisdom teeth taken out.
I'm finding too, some of these patients are not being treated correctly. So the cosmetic injector, nurse or doctor is comfortable perhaps with just treating their cheeks and their lips. So their temples become more concaved. Right. Their tear troughs haven't been addressed. The shape of their face is making them look unusual.
Yes.
And they obviously must see that to a degree. So then they're coming to me. The face just isn't balanced.
Right. And you're right. And you're very good at what you do, and you're very balanced and you're very natural approach, which I think it's unfortunate everybody's not like that. But again, if you want to wear that big striped pink and red suit out to, you go to that store and buy it.
Exactly.
I just don't have those in my office. So, but you just have to be honest with them, and everybody's got their own style. I tell people, this is kind of silly, but I say, look, you can have pizza at Spago's, you can have pizza at Domino's. Nobody's doing it wrong. They just do it differently.
Exactly.
You have to pick where you want to be. And, that's it.
I like that. You've built the most incredible practice and had, such a internationally famous career.
Thank you.
I find it very difficult to balance, family, work life. How do you do it?
Well, it's gotten easier. When I first was starting to do this, and I was making these videotapes, and I was on Extreme Makeover, and I was operating every day, I look at my surgery schedule, and you can flip through the pages, and since 1991, I've filled up every day, been operating every day, which I enjoy. But it was hard with my family because I was here trying to build my practice, and now I'm able to make different decisions and make different commitments and say no a lot more. And so my family is very, very important to me. And I really, want that time now. And that's what I'm making, an effort and commitment to make, so, but look, it was hard climbing up the mountain. It was a lot of work. And there's a lot of tread on my tires. There's a lot of scratches and scars on my legs and hands, and my heart, my brain. But now it's a different part of my life. I'm very happy. I'm glad for everybody. I think we talked about this earlier. There's enough patients for everybody.
There is.
For everybody. And you can't look at, this person is doing that. This person is doing, there's so many patients for everybody. And what builds a practice is not your hatred for somebody else or your disdain for them. No. It's just being, build your family tree. Make these people refer another person and take care of them. That's really what it's all about, is making people happy. And I hope, that's my goal too.
We've seen the industry change so much. I started injecting in 2004. What do you think is the upcoming trend of this year? What are you seeing more and more of people asking for? So our anatomy has not changed. Sure. Okay, the anatomy is going to be the same. What I think is what I've seen in my career, which is the biggest disappointment, is there's been such an improvement in marketing techniques more than really true innovation. And so it's being able to communicate something in a different way, sometimes the same technology, to get the bite, to get the patient in the door, which is unfair, because really what you should be concerned with is, it's like people come to ask me, what's new in plastic surgery? What's new? What's new? What's new? That's what you always hear. 25 years, what's new? You should be asking, what's the best? Yes. What's the best? What's time tested? What can you get a predictable outcome that's going to make somebody happy? Instead of jumping on something that, look, I've been around for a long time, and I know that a lot of things that were brand new, after 5 years, they're gone. Sure.
And so I don't want to be in that 5-year window with that technology that's going to be gone. I want to be in that window with something that could be improved, but it's been there for a long time. And it's just my position where I want to be. You won't see me doing the newest stuff because I don't want to be the newest person. I want to know what's the best. And that's just my philosophy, but it may be different than other people's.
You know what I hear a lot in my practice? Yeah, I really want to have a mini facelift. Let's talk about a mini facelift. It's a facelift, right?
Well, we were talking about this.
Yes.
I was just talking about this the other day with somebody. So my facelift is from the eyes all the way down to the neck. Okay. Do you do that on an 18-year-old? No. To me, a lot of women, they want a mini facelift. They come in and they say, I just want a little pull here, but their neck is bad.
Of course.
That's a facelift. It's including the neck.
Exactly.
The neck is there because the face has come down, creating the neck. So, but they want a mini facelift because maybe that's a softer blow. Maybe it's less of a price.
Sure.
Okay, we'll give you a mini facelift. You'll be on your way. But we've got to take care of the areas of aging that you have. Now, some people say a mini facelift is just a little tiny pull right here. Maybe it's a 33-year-old that needs a tiny pull right here.
Sure.
Then I'm going to ask you, do they really need that? Is that really what they need? Or could they get by with these transitional things like neuromodulators and a little bit of filler, whatever? I think the time to do a facelift is when you can do it correctly. The best facelift is going to be the first one you do. You got to do it right. It's going to last the longest. It's going to look the best, I think. And there's a lot of things that go into facelift surgery. But, I just think that, jumping on a patient that's really wanting to do it because she's 29 years old and there's movement. I had a princess from Saudi Arabia come in. She's like 29 years old. She wanted a facelift. She said, look, I got movement here. I said, you don't need it. You don't need this. She came back 2 or 3 years later. Somebody had done it because they could.
Yeah, of course.
They talked her into it. And she had the worst scars in the world. And we're trying to figure out, well, how can we get rid of the scars? But she had enough skin to do that. So, everybody's different. And you take everything by case basis. But, you do it when you need it and do it right when you do it.
A lot of patients come to me and say, I just want this.
Right.
So there is still a lack of understanding that this is perhaps surgery.
Yes.
The jowl has completely formed.
Right.
They have neck laxity.
Right.
And, there's that real explanation of each process and each alternative from surgical to non-surgical.
Correct.
So if a patient does go ahead and have a face and neck lift, I think a lot of people have a misconception that then their neuromodulators will just stop altogether.
That's a perfect thing to say. You're right, absolutely right. So I usually tell people aging is kind of complicated, but it's also very simple. And you see the same thing happening over and over and over again to everybody because we have a lot of the same anatomy, basically. It just happens at different times. Sometimes people fall apart at age 39. Some people wait till they're 60. We talked about that. But the three things that happen basically with aging is the tissue falls straight down with gravity and the way the muscles and the bone connect the skin. The aging is down and towards the middle.
Yes.
And we have to pull it back and up. Now we're going to remove extra skin and we're going to pull tissue back to a more youthful location. But the second thing that happens is our skin quality changes. When you're 7 years old, you don't have wrinkles, pigmentation, pore size issues. When you're 67, maybe you do. Facelift's not going to help that. That's taken care of through skin, procedures, whether it's peels, lasers, dermabrasion, whatever, needling. The third thing that happens is we lose volume in our face. If you look at a little baby or a young child, they have this big fat face, and which is youthful and beautiful. And you go to the nursing home, you start seeing the skeleton eyes sunken in things. I mean, that's the direction usually that we go. And so facelift doesn't help in that either. But if you do the facelift and the tightening first, then you're going to use less filler than if you try to fill up all the skin that's extra and sagging. And so I think there's a correct time and place to do everything. And I'm not one of those that likes, when I'm doing a facelift, to do injectables at the same time or do lasers at the same time, because I think it's more conservative and better and more accurate if you wait 3 months after that face has settled a little bit and decide exactly where that filler is going to go. You don't want to beat up two sides of the skin with a laser at the same time because it increases the risk a little bit. So why add that to that? And so for my style, I'd rather do the facelift than wait 3 months. Then you bring in all the other things. Wrinkling, I'll catch hell for this, but I don't think the sun causes wrinkles or they'd be all over the tip of your nose. What causes the wrinkles is the motion, the movement, the squinting, the smiling, the frowning. You know, I don't have wrinkles on my chin. I mean, it's been in the sun too, but the squinting and all that stuff. I'm not saying a lot of sun is good for you, it's not, but some sun is. But, you know, that's where the neuromodulators come into play, and you have to be really careful. It's like fine tuning. It's fine tuning like your light switch. It's not up and down, you know? So it's a concert and a symphony of a lot of different things that you can do at the right time by ethical doctors who are also talented, because not everybody's the same.
No.
And nurses, they're fantastic. I've got a nurse in my clinic that does injectables and Botox.
I love Jody.
Neuromodulation. She's fantastic. She's
wonderful.
Conservative. You know what? She's been here 25, 30 years. You never hear any problems.
I was very lucky to spend a day with Jody a few years ago as your guest. So, yeah, Jody is an amazing clinician.
Thank you.
One thing that's become very popular over the last few years, and my patients ask me about, is the lip lift. But it is a surgical procedure that's been, you know, done for 40, 50 years. Talk to us about that. Talk about the aging through this part of the face and why this area of the lip elongates in an older lady, and what about this procedure for a younger woman?
Okay, so I've been doing lip lifts my entire career. This is not new, and it has been around for 40 years. And you know, but hey, we got a different name for it. This is this, now it's this, now it's this, now it's the same thing. So what happens is we get older, the bone starts resorbing and becomes less dense. Everything starts falling, and usually, and this is just usually, some people have different aesthetics, but when you open your mouth just slightly, you'd like to be able to see some of your upper teeth. I can't because mine's fallen down, okay? But usually you can see about 2 millimeters of that upper teeth. And as you get older, it gets lower and lower. That's get longer and longer and longer. So a very powerful, youthful procedure is to do this lip lift where you shorten that upper lip, show a little bit of teeth, and not take out too much where you look like a bunny rabbit, but you have to take out enough to make a nice difference. And you have to have that diagnosis of where is that lip positioned, where you're trying to put it. And then you don't want to make it too big where it overwhelms the bottom lip, because I think the bottom lip, from my perspective, should be about 30% bigger than the upper lip.
Sure.
But because it gets out of balance, and you don't want to have a duck-looking lip. So this is something that's done, you know, all the time. Some people are really great at it. Some people maybe not. But I think it's something to consider for patients. And even in younger patients, when you have the desire to have that really cute lip, then it's something that you could consider. But everything we do is a choice between imperfect alternatives. There's a trade-off. You're going to do this, you're going to get that. You're going to do this, you're going to do that. You just have to understand what's the other side of this. When you're negotiating this in your brain and your pocketbook, what's the other side of this? And understand it clearly.
When I see a patient and the lip, especially in a female, is completely inverted, which means it's tucked under, and they are under the impression that as a clinician, I can just turn that out with filler, which I cannot.
No.
So what's happening is that these patients are going to different people and having all this filler injected, and it looks very strange. So would a lip lift be an alternative for someone with that very inverted lip?
Yes, it might be if you're trying to shorten this distance and you're looking at the relationship between the upper and lower lip. There's a way you can go behind the lip and release it where it rolls out a little bit too, by either the scar here or the scar inside. There's different options, but you know, taking on a patient that they think it's going to be solved by an injection and you know it's not, it's just going to be a problem for both of you.
Absolutely.
Yeah. And it's like, I'm going to get some sleep tonight. I'm not going to be answering this phone call 20 times next week because they're unhappy. It's just better just to say, look, no. No is the most powerful word we have.
What is next for you, Dr. Garth Fisher?
Probably more of the same. I enjoy my life. I enjoy my family. I enjoy my practice. I don't really currently have any complaints. My health is good. I'm happy. I travel quite a bit, and that's where I am.
I just want to thank you so much for your time today. It's been a wonderful chat. Dr. Garth Fisher.
Thank you very much. It's nice to be here.